Hello, thank you for joining me in my little sharing about cervical cancer awareness. I'm one of three gynae-oncologists in Hospital Likas. Now, whether or not you pronounce this as cervical cancer or cervical cancer, if you type to Mr. Google, he will tell you right before the COVID pandemic, the global incidence of cervical cancer is a tragedy. Globally, the cervical cancer incidence and mortality in Asia comprises more than 50%, as it is shown here. Bringing up the Asia chart, I want to highlight the comparison between Malaysia and Japan. Japan is much higher in incidence compared to us, simply because screening is better over there and mortality rate is much lower. So we've got some work to do to be in comparison with them. Now, the most common cancers in Malaysia, apart from breast, lung, and colon, cervical cancer is up there in the top 5. 1 in 20 Malaysian women are at risk of breast cancer during their lifetime. Whether you like it or not, 2 women die from cervical cancer every day. It is the third most common cancer among Malaysian women. It is the number 2 killer among Malaysian women. So it is serious. Even if it is the top 3 cancers, it is, however, highly preventable. Knowing about HPV infections may save your life. 3 out of 4 women with cervical cancer are under the age of 64. It is the persistence of HPV which is important. Take back message today. More than 99% of cervical cancer is caused by HPV. Now, there are more than 150 types of HPV. It is the high-risk HPV that we are concerned about. The next time if you eat broccoli or cauliflower, think about HPV. Now, signs and symptoms of cervical cancer. You may have unusual vaginal bleeding in between periods, after period, or after sexual intercourse. It may be associated with watery or bloody vaginal discharge. Maybe you would have pelvic pain. If you have all these, get them checked out. How to prevent cervical cancer, either primarily or secondary, with cervical cancer screening or immunization. Gardasil 9, as the number suggests, it covers 9 high-risk HPV. It is available in Malaysia. It is the latest in the market. We used to have an immunization schedule for school-going children with 2 shots and 3 shots for adult or adolescents, young adults. It used to be between 9 and 26 age marketed. Now it is open up to 45 years of age. It is also available for men. Talk to your doctors if you're interested. Now, conventional pap smear screening or liquid-based cytology or HPV DNA is the way to go to prevent cervical cancer. If you're between 20 and 65, are sexually active or had been sexually active, we recommend the first 2 consecutive years screen yearly. If it is normal, screen 3 yearly. If HPV DNA screening, you are above 30 and between 49, you should be screened with HPV test. If you're not between these ages, do pap smear screening. So in a span of 10 years, you should have had 2 HPV tests or 4 pap smears. Then you're up to date. If you do have HPV, it does not mean that you have cervical cancer. It just means that you may have a higher risk of getting cervical cancer. 70% of sexually active women will get HPV in their lifetime. Most of us clear these within 2 years. It is those that do not clear them. We are a bit concerned. We will do more screening, either by colposcopy or resection. If you do have HPV, it does not mean that you cannot be vaccinated. Yes, you can. It will reduce the risk of getting cervical cancer, but it does not mean that you do not need any more screening. Yes, you still do need to do pap smear screening, and yes, you still do need to do HPV. Over the years, we've had people talking about cervical cancer, spreading about awareness about it. We've had major spokesperson and influencers talking about it, reaching out to the young adults so that it will be known and we will be educated. Get vaccinated and get screened. That's the way to go. Cervical cancer-free Malaysia, that's our hope. In conjunction with WHO cervical cancer elimination strategy, 90% of girls fully vaccinated with HPV by age 15. We were about 84% by 2020. 70% of women screened with high performance tests by 35 and again by 45. We had been about 40% there. 90% of women identified with cervical cancer received treatment. We are on our way there. So, cervical cancer-free Malaysia, hand in hand we go. That's my talk. Thank you very much.